Welcome back. Well, women, if you had to guess what was the most deadly for us over all forms of cancer combined, what would you think it was? Well, Tina, I'm here to tell you it's actually heart disease. It is actually the #1 killer of women, with 1 in 3 women dying of a heart attack or a stroke.
Wow. Well, specialists worldwide told our next guest that after surviving a massive heart attack, bypass surgery, and a stroke in her early 40s, it was her healthy diet that saved her life. Now, Kelly Hill is here with us today to help other women. So first, thank you for that, taking your life experience and kind of paying it forward.
Well, for me, it was just an everyday day. I mean, it was nothing special. I'm running up and down the steps, doing the laundry, checking my kids' homework, talking to a girlfriend on the phone. Average mom day, nothing special. And then all of a sudden, I just couldn't breathe. And then it felt like an elephant was on my chest, and it was just excruciating. And my husband rushed me to the hospital. And they told me nothing was wrong with me. They told me maybe it was panic attack, anxiety, heartburn, indigestion, and I knew myself well enough. The healthy diet let me know that there was something seriously wrong, and I refused to leave the hospital.
Really?
And before they could even get me set up for the next run of tests, 100% blockage of my LAD, the Widowmaker. Within 10 minutes, I would have been dead if I hadn't had the strength to say, you're wrong and I'm staying here. So women really need to be their own advocate. But then, unfortunately, less than a year later, that stint didn't hold. So at 43 years of age, I had heart bypass surgery. I joined the Zipper Club. Everything seemed great for about a year, and I went to call my dogs. I have beagles, which we're all so proud of right now, but I have beagles, and I went to call them, and what came out of my mouth was not my dog's name. And I sounded drunk, and I realized I couldn't do this. I looked in the mirror, and my left side of my face was all drooping. I'm drooling all over myself because I couldn't swallow. And at 44, I was having a stroke. I'm a lucky one. I lived through this, but like you said, 1 in 3 women die from heart disease. I mean, and a heart attack. This is something that women really need to pay attention to the symptoms. If I had known the symptoms, I could have prevented my heart attack. I had 4 of the 5 major symptoms for months, and I ignored them because I didn't know.
And Kelly, I'm sure some of our viewers are watching, looking at you, saying, oh my goodness, this beautiful woman who doesn't look at all old enough to even have any kind of heart complications or any medical issues, and
happen to anyone.
You've already been through this. Now, please run down some of those symptoms in case there's somebody watching that might be experiencing them.
Definitely, definitely. So I put them in an acronym that I hope will help women. Of course, it's HEART, because that's what we're talking about. So H is for hot and cold flashes. E is for exhausted, and I'm talking the exhausted where you go to bed tired and you wake up tired. A is for aches and pains in the jaw, neck, shoulders, upper back area. Mine was right between my shoulder blades, and I had it for months. I just kept thinking I slept wrong. We ignore these. R is for feeling like you're going to retch. Any type of reoccurring nausea can be a sign of a heart attack. And T is trouble breathing. That's the one that got me into the hospital. So we need to pay attention to these as women because we have a tendency to just brush those off and think it's the flu or stress or I'm a bit under the weather when we may be potentially having a heart attack. So we need to pay a lot of attention to those symptoms.
And so now, reflecting back, you're saying, had I known that these symptoms were leading to a bigger situation, what could you have done, or what would you have done different?
Definitely get to the doctor right away. Go have those blood tests done. It would have told the truth. I would have been able to prevent having that heart attack if I had known. I just didn't know. So the best bet, call your doctor. If you've got a few of those symptoms or you're even unsure, very much like when I was in the hospital, I really felt like there was something wrong. If we have the most amazing instinct as women. If you feel something's wrong, do not trust the doctor. Sorry, doctors, but I mean, you know your body. Be honest with yourself and stand up. Be your own advocate, and it'll make a huge difference.
That's great advice. Now, you said you think you could have prevented this heart attack. What are some of the ways you think you could have prevented it?
Just knowing. If I had known that I had 4 of those 5 symptoms, and if I'd paid attention, I had excuses for all of them. I have a 6-year-old son. Of course I'm tired. You know,
exactly.
I mean, give me a break. Of course I'm tired. You know, I felt like maybe I just slept wrong. So aches and pains are just part of life as we age. You know, I just kind of ignored them because it seemed like everyday things. And when they added up, though, they're very big red flashing lights that I need to pay attention to, and so do other people.
Well, what about diet? How does this all play into it?
So this is what really saved my life. Is I was so healthy, I could say I'm not having a panic attack, I'm not having indigestion, I'm not having heartburn, and so I brought some of my favorite heart healthy foods. Leafy greens are amazing. Now these have so many health benefits, I can't even go into them. But the best one for heart is they reduce your blood pressure. They regulate your blood pressure completely. We also have nuts, which reduce plaque in our system. We have oatmeal, but any whole grains are fabulous. Just make sure that they're really whole grains, no instant oatmeal, we need the real thing. Olive oil and avocados reduce cholesterol. And tomatoes have a great antioxidant that actually gets rid of free radicals, which are the bad guys in our blood. So they're better if you cook them just a little bit, in fact. So I have lots of these great foods, and anybody, if they're looking at these and going, I have no idea what she's talking about, this is chard, what the heck is that green thing she's talking about? I have tons of free recipes on my website to help people start using these heart healthy foods.
Excellent, Kelly. And where can we get your book?
Amazon.
Perfect. Well, thank you so much for joining us
Thank
today.
you.
You look great. You look healthy. We obviously need to follow your advice. And for free recipes and health tips, you can log on to kellyhillnutrition.com. And for more information, you can call 855-772-PLAN. That's 855-772-7526.